Hello, everyone. I'm Ceara Corry, also known as See the Sex Lady. I am a sex therapist and sex educator, currently based in Greensboro, North Carolina. I'm able to see folks all across the state of North Carolina virtually, as well as the state of South Carolina. The name of my practice is The Naked Truth, and I see folks who are wanting to work through or work on concerns related to sex, sexuality, intimacy, relationships. So I also do relationship therapy. So pretty much anything that has to do with how you think about sex, how you feel about it, how you experience it, how you want to experience it, things that may be happening in your relationship or not happening in your relationship. I do a little bit of all of that.
So the biggest question that I got was just like, what exactly is sex therapy, and how would you compare it to, someone going to see, a quote unquote regular therapy?
Yeah, that's the biggest question I get, or the question I get most frequently as well. So, sex therapy is a form of talk therapy. So, it is very similar to going to see, like you said, a regular therapist in the sense that the sessions will look similarly. It is you sitting across from a therapist and talking about some of your concerns, talking about your questions. The primary difference is the focus area and what some of the strategies or techniques that you're practicing or working through with your therapist. So a lot of times people are like, are people naked? Are people having sex in front of you? I'm like, nope, none of that is going on. Everybody has their clothes on. We are talking about your sex life, but it's not something that I'm watching or present for. And so, yeah, it's very conversational. I do tell people I might get a little more in your business than therapists you've had in the past, asking a little bit more about what sex looks like, feels like for you, how you think about sex, how you came to think about sex in the way that you do. I'm doing a lot of things with clients that are very sensory focused and just helping them get a little more into their body, a little more connected with their emotions. So in some ways it's very similar, but the topic area and some of the approaches may be a little different.
So what are the different strategies that you may use that may be a little bit different than, whether it's CBT or DBT or, yeah.
Yeah. So I do some of that as well. I do use some CBT, I do some mindfulness things, but some things that are more specific kind of to sex therapy. If anyone has ever heard of sensate focus, it really is about connecting with the experience of sensation, how it feels to touch or be touched, simply from a place of curiosity, not even necessarily from the point of pleasure or for the purpose of pleasure. Sometimes we're not there yet. Sometimes it's just I don't know what I'm feeling. I don't know how to connect with my body in that way. So it's things like that. I do a lot of the formal term is like a sexual history, which is really just I want to know what sex has been like for you, what your experiences have been like, what you've learned, how you've been impacted or shaped by different experiences that you've had. So I'm talking about when you first got your period to the first time you experienced any sort of sexual desire, curiosities around masturbation, and really just getting an understanding of what experiences have shaped how you think about sex and intimacy, relationships, that sort of thing. And so if you're going to therapy for other things, you may not have as much time or space to get into some of that nitty gritty, sex history sort of thing, but I do lots of that in my practice.
I like, yes, so much. I mean, from a pelvic health standpoint, we do a lot of connecting to the body, but the way that you're describing how you feel about each experience and how that may have shaped where you are now is just such an important area.
Yeah.
It makes me think, like, if anybody wants to pop in, like, I'm curious if anyone's ever been able to have that conversation with a medical provider or a professional. Has anyone ever been asked those questions when they've seen someone? Because I haven't. So this is a really unique experience to be able to have.
Yeah. And so often pleasure is left out of that conversation. Maybe on a, doctor's office form, they're asking if you're sexually active or maybe the gender of your sexual partners. or if you've ever been tested for STIs, they're probably not asking, are you enjoying the sex that you're having? How do you feel about communicating, about your sexual needs or desires with folks? That's a lot of, the work that I'm doing as well that gets overlooked in a lot of other spaces or other settings.
Absolutely. I mean, on them, and I also think there's a lot of like, I think even our medical providers don't even know how to talk about sex.
I agree.
Which, I mean, that can be its own conversation.
Yeah.
But I'll never forget, I was seeing a woman for urinary incontinence, and she was someone who has been through menopause. And I asked her, I'd asked her about like her sexual history, and she was like, "Oh, I don't have a partner." And I asked her point blank, "Well, what about for yourself, or do you use toys, or?" And she just looked at me like square in the face and was like, "Nobody's ever asked me that question before. I'm so glad you asked it."
Yes. Yeah, I've had folks who want to know, can sex therapy help me, or is it for me if I've never even had sex before? And I'm like, absolutely, because you still probably or possibly have thoughts, feelings, worries, concerns, questions, and those are all things that we can talk through. It's not just for people who are sexually active, it's for people who are impacted by matters related to sexuality in any way.
Do you feel like, what are your thoughts around sex therapy for those that sex will be with their partner for the first time will happen after marriage?
Yeah.
How have you, like, yeah, I'm curious how that experience could go, or how we could like reach those people so they can maybe have that first experience being of one of a little bit more informed.
Absolutely. So the first thing I always say is folks who are having the best sex life are the folks who are talking about it, who are talking about what they like, what they don't like, what they need, what they want, those sorts of things. And so the sooner we can start those conversations, the better. And I think what sometimes people worry about is if they're choosing to abstain from sex, they're worried that talking about it eventually isn't going to be enough and we're going to, break a commitment that we've made, or we're going to end up having sex. And that isn't necessarily the case. And I think being in sex therapy can help with that because, again, that's not what that space looks like. So it really is just conversation. I like to start with, what do you know already? What are you thinking? What are you feeling? What are you worried or concerned about? Let's just start there with what's already kind of floating around in your head. And some of it is some more education sort of things. If we're talking about anatomy, we're talking about the sexual response cycle and what happens in our body when we're experiencing desire and arousal, how we can communicate that to our partner in a way that they can understand and be receptive to. I want to know, again, what are you worried about? Are we sometimes, there's the idea out there that the first time you have sex, particularly for people with vulvas, it's going to be painful, and you just kind of are supposed to expect that. I don't necessarily agree with that. I don't think it has to be painful the first time or the 50th time. And so we can talk about that. How do we know if this is something that's maybe my body's adjusting versus my body is communicating to me that something isn't working and we need to try something else? I also like to set the expectation that there's no rule that you have to have sex on your wedding night. There's no rule that says that. Maybe you want to work towards that. You want to build some more comfort with just sleeping next to each other or being naked around each other. And so that's what some of that work may look like. Where are we starting at? Where do we want to get to? And how can we collaboratively create a plan to get there?
Sounds like you give a lot of homework around, like, not even like sexual intimacy, but just intimacy as a whole.
Absolutely. There are some sessions with folks that some days I'm like, I didn't talk about sex at all today because there were other things that we needed to talk about instead. We were talking about communication. We were talking about the friendship in your relationship. We're talking about trust. We're talking about conflict and stress because all of that is impacting your sex life anyway. So we might as well talk about it. Yeah.
Yeah. I mean, sign me up. Really.